Last year, BC Children's Hospital's emergency department provided care to more than 13,000 children and youth between October and December. But the hospital says over a third of those patients did actually not need emergency care. Though having a sick child is scary for parents and guardians. So here to hopefully clear up some worries and get some more information is Dr. Garth Meckler, Division Head of Emergency Medicine at BC Children's Hospital. Doctor, thanks for being here. First of all, what illnesses and symptoms actually warrant a trip to your emergency department?
Thanks for the question, Dan. It's a difficult question to answer succinctly. Of course, there's a range of medical conditions. And I would say, first and foremost, that we are big believers in parental intuition. You know your children better than anyone. So trusting your gut is important. And if your gut says that your child is having a life-threatening emergency, call 911 or come to the emergency and we'll be there for you. That said, there are a range of common symptoms, particularly this time of year, that don't necessarily need an emergency room if you have the opportunity to get help elsewhere. So common things that we're seeing are, of course, respiratory infections. And while cough and congestion make children and families miserable, those are things that are not typically life-threatening, whereas children who are struggling to breathe, or if you have a verbal child who can't complete a sentence before catching their breath, those are the kinds of things that are best served in an emergency department.
Now, if a child doesn't meet that emergency bar or has symptoms similar to what you would say is less urgent, what advice do you give to parents and guardians?
Sure. Well, there are fortunately quite a few resources that are available to help people think through alternatives and even home care. So the BC Children's Hospital has a great website for our emergency department, and there's some helpful signs and symptoms that can help you distinguish what might be an emergency visit from a family doctor's visit or an urgent care visit. There are information links on HealthLink BC. Parents can always call 811 and speak to somebody to get some expert guidance, both with where and when to seek care. So those are a couple of options.
Mm-hmm. And as we head into cold and flu season, we are also, this pandemic is not over. COVID is still with us, and in some cases, we're seeing those cases rise. Without asking you to make any predictions or factual predictions, in fact, what are you expecting for this respiratory season this year, given we still have COVID and we're heading into flu season?
Thanks. Yeah, your caveat is important. Our ability to predict was thrown out the window with the COVID pandemic. That said, we have a lot of smart people who have been reviewing data from the Southern Hemisphere because, of course, their winter is our summer. And so we can usually look to the Southern Hemisphere to get a sense of what's coming. And so we've been looking at data from Australia, New Zealand, and South America, and we are expecting an increase in viral infections, both COVID and then the common viruses that we see every fall and winter, such as RSV and influenza. And based on activity in the Southern Hemisphere, we expect that we will see unseasonably high volumes early, sort of as we did last year in the viral surge that you've reported on.
Dr. Garth Meckler, we appreciate your time and your expertise. Thanks for joining us.
My pleasure. Thanks for the opportunity.